Hello, everybody. This is my video on phase 3. I chose gender differences in physical activity and sedentary behaviors. More exactly, I chose this article that are results over 200,000 Latin American children and adolescents. The research phase is the gender difference in physical activity and sedentary behavior. The area is seeing physical activity patterns and gender differences in youth and adolescents. The major affiliations for the authors that did this review were Universidad de la República in Uruguay, Children's Hospital at Eastern Ontario Research Institute in Canada, Pontificia Universidad Javeriana in Colombia, and Pennington Biomechanical Research in the USA. It's an international journal, and the impact factor is a 3.7. The metrics, a Q1 peer review, multidisciplinary, and open access journal. And finally, the reputation is a high global visibility reputation. Okay. So, a little introduction about this article. The overview is that physical activity, or PA, if I refer to PA further over the PowerPoint, and sedentary behaviors, or SV, are key determinants of health across lifespan, as we all said already in our previous presentations. Global trends show that many adolescents fail to meet PA recommendations and spend excessive time on their day-to-day doing sedentary activities. Evidence suggests that consistent gender differences exist. Males are generally more active than females. Understanding these differences is very important, and it's crucial to design targeted interventions and promoting that equitable health outcomes, more equal between both. The purpose of this review is to systematically review and meta-analyze studies assessing gender differences in physical activity and sedentary behaviors among children and adolescents in Latin America, quantify the magnitude of these gender differences, and highlight regional patterns and research gaps that could inform future PAs or anybody working in the health field promoting future PA promoting strategies. So the methods that they use, this is a systematic review and meta-analysis conducted following the PRISMA guidelines. As we can see in the picture, they started with 47 articles and they found them in PubMed, Scopes, and Web of Science. But then they went through their data search and analysis, and the inclusion criteria was studies conducted in Latin America. Participants were between 5 and 17, and they reported gender-based comparison in physical activity and sedentary behaviors. They ended up with 33 studies. How did they get the data and how did they do their analysis? They extracted the sample size, the country that they got it, the physical activity and sedentary behaviors measurement tools, because it's based on 3 different tools. I'll talk about it in a second, and the outcomes by the genders. Then the meta-analysis was performed using random effects model to estimate the pool of gender differences, and they also assessed the heterogeneity with I-square statistics. Okay, so these are the questions, right, that they ask for physical activity assessments, and also the ones they ask for the recreational and sedentary behavior assessment. These are some of the examples. It's not all of them, but those are good, really good examples. They use different surveys based on the country that they were at, and also they used accelerometers and self-reported. So here the results. These are all the surveys that they used, but they ended up only using 11 of these countries. They had 35 studies, and sorry, on the Prisma it said 33. So sorry, I made a mistake. They had 33 studies. The participants were more than 120,000 children and adolescents across these 11 countries. And here we have the 11 countries that participated. We have the sample size, the country, we have the study, we also have the measurements. As we can see, some of them used accelerometers, others use questionnaire or surveys, and also others use self-report surveys. So it was made with 3 different measurements. Also, we have the main comparison results, but we'll go into the results in a second. So the main finding, boys were consistently more physically active than girls across the countries, and girls at the same time exhibited a higher sedentary life, especially during the adolescent phase. The moderators, it's socioeconomic status, cultural norms, and access to sport opportunities. It's different between some of these countries. Okay, now we're going to a little more in depth of these results. Here we have some of the plots. Each study comparison of physical activity levels between boys and girls. So this is physical activity. And then we have another one for sedentary behaviors because they studied both separately, but they found consistent results. So most individuals in these points are to the right of the zero line, right? So that means that boys were more active. The size of the square reflects the weight of the study in the analysis. So the larger they are, the larger sample they had, the more kids they had. Also, the pool diamond all the way at the bottom shows a positive overall effect size around 0.35% within 95% of confidential interval. Sorry, 0.35, not 0.35%. With 95% of confidential interval, no crossing zero, meaning it's statistically significant. How do we interpret this? Basically, across all studies, boys had significantly higher levels of moderate to vigorous physical activities than girls. Now we go to the sedentary life, right? So each study in this case compared the sedentary time between boys and girls with the sedentary questions instead of the physical active. Many studies points to the left of the zero line. So that means that girls were more sedentary than boys. The pool effect was 0.20, also favors girls being more sedentary, and the confidence interval is smaller, but it's still statistical significant. The interpretation is that girls spend more time in sedentary activities, such as screen timing, sitting, things that are not active compared to the boys. For heterogeneity, 77% and 72%, right? For both, for physical and for sedentary. That indicates that there is a variability between the studies. We gotta be careful when we analyze these results because it means that the results in the studies vary a lot, possibly due to difference in age, country, measurements of the tools, because remember we said they were measuring 3 different ways, or cultural factors. So when we analyze the results, we gotta be careful and we gotta take all these things into consideration. Some conclusions, important findings is that there is a significant gender gap. Boys are constantly engaged in more moderate to vigorous physical activity, and girls are more into sedentary activities across Latin American countries. Consistent pattern across measurement tools, accelerometers, I cannot say that word, questionnaires, and self-reports, despite the cultural and socioeconomical difference. Some applicable and practical applications from these results. At schools, we need to develop inclusive PE programs that encourage both boys and girls to participate and give them confidence among the girls. Okay, sometimes when we're at school, only boys want to do the things that are a little bit more active. We gotta give girls this confidence to also participate in them. Community programs, we gotta offer gender sensitive activities, for example, doing non-competitive social exercise, some of these options. Policy support initiative that reduce barriers between the participants. Safe recreational spaces, that's very important, and more in countries like South America, of course. After school activity accesses, future research, we gotta explore the psychosocial and cultural factors influencing this gap, because we gotta keep in mind that this study, even though it's taken internationally, it was done in South America, and the cultural factors and social factors may affect these results a lot. Okay, when we connect it to other phases of research, so when we try to connect it to the benefits on physical activity, things that we have all been talking about in other phases, right? This study reinforces that low activity levels among girls may increase the risk for poor outcomes and more when they grow up, such as obesity, cardiovascular disease, reduced bone health. That's very important. Also, when we tie it to barriers and facilitators, it highlights the need to address gender-based social norms and environmental access to physical activities. Finally, for intervention design, findings provide baseline evidence to create targeted interventions that promote equal physical activity opportunities among boys and girls. Some strengths and some weaknesses of these studies. The strength is that it's a comprehensive scope, includes 35 studies. I don't know why I kept putting 35 when it was 33, but 33 studies across 11 Latin American countries, providing strong regional overview. It used multiple database and Prisma guidelines, so increase the transparency, replicability, and reduces publication bias. It was a meta-analysis with effect size, so it quantified the magnitude of gender differences. It not only said there is a difference. It told us how much is this difference. And a variety of measurement tools. As I said, we use 3 different things. So we combine all of 3 to a broader perspective. Public health relevance. It offers important evidence of these gender-focused health differences and gender-focused promoting and physical activity policies. Some weaknesses, though, on the other side, as we talked already, the high heterogeneity, it's between that 70 and 80%, indicating larger variability between the studies. Results should be interpreted cautiously, but I already talked about that. Unequal representation. Some countries had few or not studies, limiting the ability of us to generalize across Latin America. Measurement inconsistency, use of different physical activity and sedentary behavior assessment tools reduce the compatibility between these studies. It's hard to compare studies when they're not using the same tool to measure it. Cross-sectional data only limits the ability to interfere causal relationship between gender and activity patterns because it's a cross-sectional. And finally, a limit exploration of contextual factors. Few studies examine the socioeconomic, cultural, and environmental influences that may explain these gender differences. For future studies, the author says that there's a need for longitudinal research. We just talked about the cross-sectional, right? So there is a need for longitudinal research and track the changes in physical activity in sedentary behaviors over the time when these children and adolescents go into older ages. Also, explore the contextual and cultural factors. We have to examine how social norms, gender expectations, and access to facilities influence behaviors, because we know in South America there's still a little bit of machismo, so that may be affecting. We would need to study that part a little bit more. We need to standardize measurements methods, consistent tools instead of 3 different tools. We need to use a consistent one to reduce variability across these studies, that heterogeneity that we got. Intervention-based research, develop and test gender-sensitive physical activity programs to see if they help address the specific barriers between the boys and the girls. And policy-oriented studies evaluate how schools and communities policies affect the gender equality and physical activity participation. On my hand, though, I think, well, on my hand, because I do biomechanics, I think we should bridge biomechanics and behavior. Future research could explore how movement patterns, gauge and loading relate to gender differences in activity preference and injury risk. We know some injuries are more prevalent in one gender than the other. We can incorporate technology, use wearable sensors and monitor capture to objectively quantify activity and identify subtle difference between genders. Focus on intervention effectiveness, assess how targeted programs, so actually apply the programs, improve girls' physical activity levels. Some examples are mentorship, community engagement, any of those programs. Cross-disciplinary approach, combine insights from biomechanics, psychologists, public health, and any other field to understand both mechanical and social barriers. Educators would be a part of it too. And finally, expand global representation. So conduct similar meta-analysis in other regions to compare trends and cultural influences. That would be a great way of measure that social and cultural aspect, because we would be comparing it to other cultures. Thank you very much, guys, for listening. I hope you liked it. If you have any questions, leave it on my comments.